Hey, this is Bob Wright here, and today's Ask the Expert question had to do with a study that was published earlier this year, this past summer, and the study suggested that calcium supplements might increase the risk of heart attacks. And of course, that's frustrating when here you are might be taking calcium for your bone health and thinking that's a good thing, and now a study suggests it might increase your risk of heart disease. So one of the things that I've always relied on as a way to keep me up to date and help put perspective on these kinds of studies are health newsletters. And so I've recommended them for many years, and we'll put a few of these on the blog. A couple of my favorites are the Tufts University Health and Nutrition Letter, the University of California Berkeley Wellness Letter, a Nutrition Action Health Letter, to name a few. It's interesting because just this past, the latest newsletter came out in December of 2010 from the University of California Berkeley Wellness Letter actually addressed that study. So if you'll bear with me, I'd like to read a little bit from this newsletter to help put some perspective on that calcium study. So this was a study that was published in the BMJ, which was formerly called the British Medical Journal. It selected 10 placebo-controlled studies, including 12,000 women, and pulled the data from them. It found that women taking calcium, about 1,000 milligrams a day, had a 27% increase for heart attacks, for heart attack risk, and that translated to about 36 extra heart attacks over the course of the next 2 to 5 years. Well, again, it's pretty scary. Heart attacks is something we're probably all trying to avoid. What was interesting is that actually quickly after that study was published, a lot of groups came out and cast doubt on the findings. So, for example, the National Osteoporosis Foundation, the American Society for Bone and Mineral Health, Mental Research, the Osteoporosis Australia quickly pointed out faults in the new analysis and reiterated their calcium guidelines. So here's a few of the concerns that were brought up about this study. The study only included 11 of the hundreds of published studies using calcium supplement. Of the 11, it seemed that only one found significant increase in cardiovascular and coronary risk. And that lone study was interestingly done by the same group that published this last data. One strength of these kinds of analysis, where they look at a number of studies and pull this data, this is called a meta-analysis, is they set strict criteria about which studies to include, but that lays them open to the charge of cherry-picking the data, a charge that has been made against this new paper. All right, so they really only looked at 11 studies out of the hundreds that have been done using calcium. Another concern is that because all the studies were designed to look at the effects of calcium on bone health, not heart disease, half of them did not have complete data on cardiovascular risk. A lot of the data was unpublished or self-reported, and so their accuracy has been called into question. Most importantly, the analysis excluded many studies that gave the subjects even small amounts of vitamin D. And as you know, whenever you're taking calcium, we recommend vitamin D. One of these was a large, well-known study from the Women's Health Initiative, which found that calcium plus D did not affect heart attack risk. Besides being essential for absorption of calcium, vitamin D may help reduce the risk of heart disease. One last point, according to the noted calcium expert Dr. Robert Heaney of Creighton University in Omaha, the BMJ article is a terrible one, he said. I am not sure why it evokes so much publicity as it has, but it does not repeal all the other good prior studies. Had the studies been included that include vitamin D, he noted the adverse effects would have gone away, and if anything, the results would have tipped in the direction of benefit rather than risk. In a large study that he and his colleagues conducted, Dr. Heaney found that women's taking calcium supplements had reduced risk of heart disease if it included vitamin D. The point of all this is that don't get alarmed when you see a study that gets a lot of attention in the media. If you subscribe to one of these newsletters, be patient. In a month or two, they'll review it and give you some perspective, and then you can make an informed decision.